at the World Cancer Congress, my talk has been about universal health coverage, cancer control, and palliative care, and specifically looking at advocacy lessons from other fields of health and human rights, and sharing some lessons from Uganda. I think the challenges to advancing universal health coverage and cancer control in Uganda is the fact that we do not have a national health insurance scheme. Yeah, that for me is a major challenge, and because the fact remains that still families and patients have to pay out of pocket for some services. The cancer services, because these are delivered through the Uganda Cancer Institute, which is a government body, are really free. But there are few, say, tests that have to be done out of the institute, maybe CT scan and so on. And of course, for these patients, have to pay. So I think the major challenge is currently is the lack of a national health insurance scheme that can cover everyone. I think as advocates, we continue to demand and to really urge government to put in place the national health insurance scheme. We do have a draft national health insurance bill, but it's still pending pending signature by the president. So I think we just have to continue advocating for this. I think the other constraint is really, you know, the budget constraints of low-income development countries, that there are so many priorities. So the budget has to be divided into so many other priorities. So of course, even funding becomes a challenge. Although the government is progressively, you can see progressive efforts towards financing the Cancer Institute. There are plans to decentralize cancer services from the center to regional cancer centers to decongest the center, but also to ensure that services are closer to the people. I think the integration of cancer care in all other services is very important. Whether it is HIV/AIDS, we need to be streamlining cancer care or cancer control, because within the HIV/AIDS programs, people can understand issues around cancer. We can easily integrate prevention there, and we can easily integrate early detection like it is for cervical cancer. So I think we need to integrate more. We need to integrate cancer care with other non-communicable diseases programs, cardiovascular disease, diabetes, but we also need to integrate cancer care within, you know, primary health care, so that the healthcare workers are able to catch the early signs and make referrals for management. So I think for me, integration is the way to go. When it comes to advocacy, I think we need to get cancer control integrated in other advocacy movements. For instance, the movement, the HIV/AIDS movement in the country is strong, and we can get cancer control within that. We have a vibrant women's and feminist movement, and we know that the top cancers in the country are cancers that affect women. So we can integrate cancer control within the women's movement, within the feminist movement. We have a vibrant movement on sexual reproductive health in the country. We can integrate it. I think for me, the future is really integration. Okay, one of the key plans in the country is to decentralize cancer services by establishing regional cancer centers, and this is a mandate given by the law. And what that means is that the Uganda Cancer Institute, which is at the center, will establish regional centers under it and manage these centers so that the services go closer to the people. Currently, most of the patients have to come to the city center, which is far for many. And also you can lose patients to follow up because of issues like transport, issues like accommodation in the center. So that decentralization through the establishment of regional cancer centers that are for government is hoped to actually bring cancer services closer to the people and also reduce the congestion at the center. Yeah, I think the role has played a central role in strengthening cancer care in Uganda. Before 2016, the Uganda Cancer Institute was run under the National Referral Hospital. And in 2016, government passed an enabling law, which is the Uganda Cancer Institute law. Now, this law made the institute an autonomous body. And what does this mean? This meant that the institute gets a vote in terms of budget allocation each year. And this has actually, it's obvious that the vote for the institute has been growing each year. It has also enabled the institute to, for instance, procure cancer medicines directly, saving time and also ensuring that it's the quality that they really want to procure. It's brought in many more collaborations because the institute has that capacity to make decisions quickly. Also, this institute has been recognized or selected within the East African region as the East African Oncology Center of Excellence. And this is coming with its autonomous status. The other development is it's also attracted external financing, external support from multilateral bodies like the African Development Bank. But it's also been accredited as an oncology institute for training in cancer control. So that enabling law, the Uganda Cancer Institute, has really enabled this institute to grow and growing with the expansion of cancer services, improvement of quality. But most importantly, also the law gives the institute mandate to decentralize cancer services. So there is already progress being made to ensure that cancer services are decentralized to the different regions of the country. Of course, we are yet to get there. We need more collaborations to facilitate this. But yes, indeed, it's a good plan and we have made progress on it. Yeah, I think in addition to that, we also have the Tobacco Control Act of 2015, another law that can be enabling in terms of cancer control in the country. Although the implementation has been really slow, and I think what our countries need is that technical support in terms of implementation of, say, tobacco control laws, how are other countries doing it. So that technical support, maybe even support in terms of financial resources, because that's where I see partnership can really benefit us as a country. I think for me it is to emphasize that cancer control, UHC, are all human rights issues under the right to health. And indeed, beyond the advocacy we are doing, we need to be utilizing opportunities such as public interest litigation to demand for the services, putting into consideration the standards for the right to health, accessibility, acceptability, quality of services, availability. So I think we need to use the human rights-based approach more, and we need to use the law much more in advancing cancer control and UHC.